Egan Holmes, case number 12 CR 1522. The record should reflect that Mr. Holmes is present with his attorneys, and the prosecutors are present as well. One of the jurors wishes to speak to me. It's juror number 901. So we're going to bring her in first and address whatever it is that she wants to talk about. Doctor, why don't we have you step down for just a moment?
You'll be outside the courtroom?
You can be in the courtroom if you want. All right, the record should reflect that juror number 901 is now present in the courtroom. Good afternoon.
Good afternoon.
How are you?
I'm nervous.
Okay.
Sorry.
That's okay. I understand that you wanted to talk to me. What's on your mind?
Yes, I don't think someone in the audience realized I was a juror for this case, and so I was waiving myself due to the heat, as usual. And they talked to me, and I was just hoping that wasn't... I didn't talk much back. I just said that I was hot, so...
What was it, during one of the breaks that they spoke
It was
with
during
you?
lunch, at the end of our lunch.
And what was said?
I was waving that I was hot, and they said something about being from Florida, and that was kind of the end of the conversation.
Did you reply anything?
No, I went and grabbed pretzels.
Okay.
So
And you don't know who it was, just somebody
I
sitting in the
don't.
courtroom?
I do.
Do you know
yeah.
which side of the courtroom?
That side.
Okay. But you don't know who they are? And,
No.
Okay.
No, I don't know.
And no other conversation took place?
No, sir.
All right. Did you hear anything related to the case at all?
No, I kind of just walked away
Okay.
and kind of kept my distance. So.
Thanks for letting me know. I appreciate that. You did the right thing. It's always good to err on the side of caution.
Okay.
So I appreciate you doing that. Let me have you step outside for just a moment, okay?
Okay.
Thank you. All right, the record should reflect that juror number 901 has exited the courtroom now. Any other questions that, or any other record that anybody wants me to make, or any requests that anybody's making of the court?
Your Honor, only to clarify for the record, for whatever it's worth, that the juror had gestured with her hand. The right side of the courtroom, as the court faces the courtroom, is the area where she thought the person had been sitting who brought up the issue of being from Florida. Other than that, nothing.
Okay. Anything on behalf of the defense?
Judge, I think we should try to determine who this person is. And perhaps have her point the person out, or ask the gallery if anyone in the gallery spoke to her. It's troubling if this is a member of the media who's been sitting here for some time and knows who these jurors are.
And for the record, the right side of the courtroom, and when I say the right side of the courtroom, I'm speaking about my right, is where the media has been designated to sit, and so that's where the members of the media sit. There are other folks who sit on that side of the courtroom as well. It's not just members of the media.
That's right, and I don't mean to single out the media. I just...
Yeah. So, does anybody here in the courtroom, does anybody recognize this juror as someone that they spoke to about being from Florida or being hot? And nobody's raising their hand. So I can bring her in if you want, Mr. King. I can bring her back in and ask her if she recognizes who it was.
I would ask that you do that, Your Honor.
All right. Is there any objection to that?
Oh, no, sir. No,
Okay.
Your Honor.
All
Sorry.
right. Let's bring her back in. The record should reflect that juror number 901 is back in the courtroom. Do you by chance recognize the person that you spoke with here in the courtroom, or who spoke to you, I should say, here in the courtroom right now?
I did when we were in here last.
The last time we were in here?
Yeah, I don't know if they're in here now. I didn't look.
Oh, you mean before the break?
Yeah.
Okay. But right now you don't see that person in here?
I'd have to stand up. I'm sorry. No, I don't see them anymore.
Okay.
They were sitting behind, I think it was like the second or third row, I believe, on that side. I
All
don't
right.
see them anymore. They were
Okay.
in here, though.
All right. Thank you. I appreciate that.
Okay.
All right. Thank you very much. We'll have you step out again. Thank you.
Okay, thank you.
The record should reflect that Juror 901 has exited the courtroom again. Any other requests, Mr. King?
No, Judge, I don't know that there's anything else we can do. I do think we should try to identify the person. Perhaps when folks come back into the room, we can ask again. I don't know.
Okay. All right. And you're not asking me to inquire any further of this juror or to make any additional record at this time. Is that correct?
That's correct.
All right. Thank you. If you want, I can ask her to let us know if she happens to recognize the person later.
Please.
Okay. Let's bring her back in one last time, and I'll ask her to do that, and then we'll proceed after that. The record should reflect that Juror 901 is back in the courtroom. I promise this will be the last time.
Okay.
It occurred to me that it may be a good idea for you to tell us if you happen to see this person again in the courtroom. Would you let us know that?
Right
now? No, well, right now,
Oh.
right now you said that you don't see the person,
I
right?
didn't know. I didn't
Okay.
see them.
Which is fine.
Okay.
But later on, if you happen to recognize the person,
Okay.
would you just send a note to my staff?
Sure.
So my staff can give it to me and just describe the person by where they're seated and perhaps what they're wearing, something along those lines, so that we know who you're referring to?
Okay.
All right.
I will do
Great.
that.
Okay. Thank you very much.
Thank you.
All right. The record should reflect that Juror 901 has exited the courtroom again. All right, let's proceed. Are the parties ready for the jury, Mr. Bruckler?
Yes, Your Honor.
Mr. King?
Yes.
All right, Dr. Reed, if you would resume the witness stand, please. Oh, Ms. Brady.
Judge, I just want to let the court know, I don't think the elevators are working, because I was stuck on the third floor, and it would not let me come down, and I was pushing buttons frantically until it buzzed, and finally I came down, but just to let the court know.
Okay. All right. It was Mr. King who asked that we do that to you when you were in the elevator.
I just, in case after the next break, I don't show up, check.
Okay, thanks for letting us know. We'll check into that. Would you please let someone know that something's up with the elevator? Thanks. All right, let's bring the jury in, please. Mr. Bruckler, before the jury comes in, how long is your next segment?
In total, Your Honor, it is 2 hours and 38 minutes.
Okay, so we'll play part of it today and then the other part tomorrow morning.
2 hours today, 38 minutes tomorrow, Your Honor? No, I'm kidding. Do you want me to plan on stopping at 5?
Yeah, I think we better. Please be seated, everyone. The record should reflect that the jury is now back in the courtroom. What all do you have going on the floor over there? There's some strange sounds coming from the floor. All right, Mr. Brockler, you may proceed. Doctor, I remind you that you're still under oath.
Doctor, here's what I failed to do last time. I failed to get you to lay the foundation for our next video clip. Your Honor, may I approach the witness?
You may.
Sir, I'm handing you 2 discs, just like before. They're each numbered 1007, but one has our office seal, one does not. Have you viewed in its entirety, the 1007 that has the office seal on it?
Yes, I have.
And within the parameters of the court's orders, is that a fair representation of the August 1st, 2014 a.m. Interview assessment you did with the defendant?
Yes, it is.
The other disc, the one that doesn't have the seal, that's the one we tried to make the sound better on. Did you also do what you did with the last exhibit to make sure that it is also consistent with that August 1st, 2014 interview?
Yes, I checked the beginning and ending times and the video at the very beginning, very end.
Your Honor, I'm going to move for the admission of People's Exhibit 2007 into evidence.
Mr. King, any additional objection?
No additional objection.
All right. Without additional objection and based on my previous rulings, P-TR-107 is admitted and may be published.
And I think I said 2007, Your Honor. I meant 1007. Thank you.
All right. You did say 2007, but the record is clear. It's 1007. Thank you. And Doctor, if you wish, you may do the same thing you've been doing throughout.
Thank you.
I will dim the lights again. Well, you took care of the air conditioner problem. Do you want to call Ms. McCager again, please? Yes. Yes.
That's all right. We've already had a busy morning. Have a seat. Let's see if we got some juice for you here. There you go. Well, you've already seen Dr. Gray this morning for some more testing, right?
Yep,
Went okay or no? How'd it go?
fairly well.
Fairly well. Okay. Any questions or anything about the things that we've talked about so far, or anything that you want to add to what we've talked about in the last couple of days?
Nope.
Okay. I'm going to ask you a strange thing. I'm going to ask if you see any differences between the way I'm dressed today and the way I was dressed yesterday.
Same bow tie, same jacket. Got some sort of pin on the.
Okay. Was the pin there yesterday as well?
Oh yeah, cowboy boots yesterday.
Okay.
Yeah, the pin was there yesterday, I think.
Okay. Any other differences? Any differences, I guess? You mentioned the cowboy boots are not here today.
That's about it.
Okay. Alrighty. I'd like to start this morning with something that folks are calling your notebook. I'm not sure what you call it, but it's the computation book for the course of life.
Right. Yeah, I just called it the notebook.
Okay, the notebook. All right. I'd like to go through it a little bit and ask you to explain some things to me, would you?
Okay.
Okay. First of all, over what period of time do you recall that you created the things in the notebook?
I think it was over June and July.
So you started it about June of 2012,
Right.
within a couple of months of the shootings? Less than a couple of months of the
Yeah,
shootings?
within 2 months.
Okay. Can you tell me why you created that notebook? If you remember.
To educate the psychiatrist, Fenton, so something like this wouldn't happen again.
Was there any other purpose to creating the notebook besides educating the psychiatrist?
Well, if I died, it would have kind of told my story.
Okay. You're not saying, and I'll ask you if it's true, you're not saying that you did it for a personal reason, as one might write a diary or a journal, just to kind of get things out, or for something inside you. Is that accurate?
No, I think it was because I have trouble communicating very clearly, so I kind of wrote it down as a way to get it out.
As a way to get it out. From the beginning, did you assume or intend that other people would see it?
I intended my psychiatrist to see it.
And that would be Dr. Fenton?
And
As
Feinstein.
Feinstein. How about Ms. Roth?
She was only doing the introductory interview, so no.
She just did the one training session or evaluations. What did you think that Dr. Fenton or Dr. Feinstein would think about it or perceive from your notebook?
don't know how they would take it.
Did you have any thoughts at that time about how they might take it or what they might think or feel as they got it and read it?
No, I didn't put myself in their shoes.
Looking back now, how do you think they might have taken it or perceived it?
They might have perceived it as useful, diagnostic tool or something.
Anything else?
They might have been surprised that there was all this stuff I didn't mention that I did mention in the notebook.
Okay. Such as?
The whole human capital kind of explanation of it.
And you go into that in some detail in the notebook.
Right.
And you also talk about in the notebook why you didn't bring it up, or at least a reason or two that you didn't bring it up in the sessions, as I recall.
I don't remember.
Okay. Do you think Dr. Fenton cared about you when you were in treatment with her?
Yes, but not very much.
Tell me what you mean by yes, but not very much.
Well, we usually had short sessions that were like 5, 10, 15 minutes long when we had a whole hour reserved for the appointment.
I didn't realize that. Tell me more about that. The sessions were shorter than scheduled or shorter than you thought were scheduled?
Shorter than, yeah.
Tell me more about how much time in the particular sessions do you remember spending?
I remember most of them were very brief. There wasn't much psychoanalysis or anything. There wasn't much psychoanalysis. It was mostly, how are you feeling with the drugs? Is there anything we need to change with the medication type of thing?
And when you say brief, if you remember, what does that translate to roughly in minutes?
10 minutes.
Were there any sessions that were much longer than that you recall?
Well, the first one where she kind of got all the information, and the ones with Feinstein were longer than the ones with her alone.
Okay. So that's one part, at least, to your comment. She cared, but maybe not too much, or I don't remember your exact words. Anything else about how much she cared or didn't care so far as you could see at that time?
I think she was paying attention and doing her best.
Paying attention, doing her best. Is that what you said?
Yeah, in treatment.
Okay. Once again, I'm a little deaf. Do you think she paid attention to you as well as any of her patients, or, I mean, you can't really know.
I don't know about her other patients.
As you speculate, did you feel that you were being paid enough attention to as a patient?
Yes, but the treatment wasn't entirely effective, I could say.
Okay. How did you, I believe you mailed the notebook to her?
Yes.
Okay. Was that by U.S. mail?
Yeah, USPS.
U.S., okay. And when did you drop it in the mailbox, or how did you do that, and when did you do that?
This was something the media got wrong.
Okay.
They thought I did it a week in advance, but that's when I think bought the bubble envelope. So I did it on Thursday, the day of, I guess.
Then, correct me if I'm wrong, do you recall, Thursday was the 19th?
Was, yeah, the 19th.
And as we go into after midnight, we're on Friday the 20th. Is that the way you remember it?
Yeah.
Do you think she got it?
It got intercepted, and then like they put it through all these bomb testing and that kind of thing.
How do you know that?
Testimonials of the bomb experts and everything.
Okay, thanks. Did you think that having the knowledge of the notebook would change what Dr. Fenton or Dr. Feinstein did in the future? You said that you thought it might be useful.
I don't know how they would change their procedures.
And forgive me if I'm not remembering. Do you mean you thought it would be useful with regard to understanding you, or with regard to understanding other people as well?
Me as well as other people.
As well as it? Okay. That brings up a question in my mind of what do you think about any similarity? I'm not asking that very well. Do you think at the time that there were other people with thoughts and concerns and difficulties similar to yours?
Yes.
Okay. Were there a lot of those people as far as you knew or thought, or not very many?
No, a very low percentage of people.
Okay. And are you speaking now, or are you speaking what you thought at the time, or both?
Both.
Okay. Were there other people who had thoughts of and drives to kill other people?
There were, but I don't personally know them.
What's your impression of how many folks out there had similar thoughts and feelings, and you used the word obsession yesterday, similar to yours? What's your impression of roughly how many people were very similar?
Oh, like 1 in 100,000.
Okay. We see a few people who kill lots of other people. Is there a reason you think that we don't see more of that then? 1 in 100,000 would mean there are roughly 10 in the Denver area.
A good law enforcement agency can stop most of them happening.
That leads me to ask, how is it that they didn't stop you?
I didn't fully reveal my plans, my full plans.
Okay. Thank you. Let me turn to the book itself now. Okay.
Okay.
I'm going to go through some of the pages and kind of show them to you. One of the things I'm real interested in is the symbol. This symbol.
Right.
You have it on the wall of your cell.
Yeah.
And I see it in other places in the notebook, etc. Can you tell me about the symbol?
It's a symbol I call the ultraception, and it's just that any problem can be solved with death.
Okay. I'll hold it up a little bit so the camera sees it. Ultraception. Any problem can be solved with death. Are there parts of the symbol that illustrate some of that principle or some of that thought?
Well, it's constructed from a 0, 1, and infinity overlapping.
Okay.
And it's kind of anthropomorphic. It's just kind of like a face.
I have not noticed that, but it is sort of like a face. What do you see in the face? I'm curious.
That just kind of personifies it and gives it like human characteristics, so it's applicable to humans.
Okay. So, all humans, or is there some kind of human in that face? Some kind of person?
Abnormal human.
An abnormal person?
Yeah.
You?
Like a mentally ill person.
Can you say more about that? And does that have a relationship to the concept of falseception?
No, there's not much more to say.
So the circle is actually a zero.
Yes.
Okay. In the one that's on the wall of your cell, there's a little shading at the edges and a little peripheral stuff. Is that relevant to the symbol, or is that just decoration of the central symbol?
That's kind of like a frame.
Okay. Thank you. There's lots of stuff on this page. Can you give me an idea of what some of the things mean?
That's the kind of human capital idea of placing values on human beings. So I give them an arbitrary value of 1 if they're alive and 0 when they're dead. And then they either add up or they subtract to the person's value when there's when they die from a murderer.
When they die from a murderer. How about when they die in other ways?
Well, then their value goes to 0 because they're no longer alive.
In this system, if they die in some other way, does their value disappear or does it accrue to someone else?
It disappears.
So the only way, and again, I don't want to put words in your mouth, the only way it accrues to somebody else is if they're murdered and it accrues to the person who killed them.
Right.
Is that accurate?
Yeah.
What if a person kills them accidentally?
It would still be transferred.
Still be transferred?
Yeah.
Do the characteristics of the person matter? Successful, not successful, big, small, young, old, male, female?
It depends on if you want it to or not. Like you could say a millionaire was more important than a homeless person. But I just attribute it to an intrinsic value of this person is worth 1 value.
Within the theater, you attribute a value of 1 to each person who was killed, and thus you're now at 13.
Right.
Is that that's what you said yesterday?
Yeah.
At the time, if you knew that one of the people killed was a millionaire, would you have given that person a value greater than 1 and assimilated more than 1 for that person?
No, I just left it as 1.
Okay. Is that your decision, or is that the way you perceive the value in the universe, or what?
It's just the way I imagined it.
You use the word imagine.
Right. Or thought of it, I guess.
Okay. Any difference between the value of men and women?
No.
Do you happen to know how many men were killed, how many women were killed?
No, I don't know.
I'm sorry?
I don't know the ratios.
Did you make any attempt to shoot certain kinds of people, men, women, big, small?
No, just people in the theater.
Okay. There are a couple of pages about your self-diagnosis
Right.
in the notebook. And we've talked a little bit about that, and you've talked with other people about that. You've come up with a whole lot of things. Where mostly did you get the diagnoses, the names, and the criteria for making those diagnoses in yourself?
Just surfing the web.
Surfing. Any particular websites useful to you? Less useful to you?
None none that stand out in my mind.
You don't remember any particular website that you
No.
went to that had some of these things? Did they tend to be scientific websites or websites with great credibility, or was it just kind of a Google search?
Yeah, it was just Google search.
Okay. Tell me about dysphoric mania. That comes up a lot in your discussion of yourself.
I thought I had dysphoric mania, so I thought I was going manic sometimes and then depressed other times.
Okay. Do you still believe that, or that's the way you thought then and you believe differently now?
That's the way I thought then. Now I kind of believe it was more just depression and then normal. So I attributed manic phases as less depressed.
Okay. You mentioned anxiety disorders. You mentioned chronic PTSD, post-traumatic stress disorder. How would that apply to you?
Yeah, I don't know of an event that would have caused it. I just meant it as stress.
Okay. And you talk about Asperger's syndrome and autism-like things. Can you tell me what you were thinking about back then about Asperger and autism syndromes?
What I know from Asperger's is it usually causes social dysfunction, and autism is kind of very focused in some areas.
And how did those apply to you?
Well, I thought I was socially dysfunctional.
Do you still think you were socially dysfunctional?
Around groups I didn't know, but around friends, yes. I wasn't.
Okay. You mentioned ADHD, attention deficit hyperactivity disorder. How might that have applied to you as you were thinking 26 months ago, 25 months ago?
Just that I couldn't get my mind to concentrate as well as I usually could.
I think you mentioned here in the notebook that you couldn't focus for more than 15 minutes. Do you recall that?
No, I don't, but it sounds like something I would write.
I remember somebody saying years ago, and it stuck in my mind, that almost nobody can truly focus on something for 15 minutes.
Is that true? Okay.
It stuck in my mind anyway, that really concentrating hard on something is a matter of a few minutes for the best of us.
Okay, so maybe I didn't have ADHD.
Schizophrenia, how might that have applied to you as you were thinking 25 months ago?
Well, I was paranoid, and then I kind of thought somebody was following me, or the FBI was onto me.
We talked about that a little bit, but not in detail. Can you tell me what you saw or heard, or thought you saw or heard back in May, June, July of 2012 that made you think you were being followed?
Well, it just said I would see more police cars than I was used to.
Okay. And in your mind then, what did that translate to? Can you go into a little more detail about how you were thinking then?
That maybe they knew what I was doing.
And how might they have known what you were doing?
I don't know that part. I don't know how they would have known. I just thought they did know.
Why do you suppose somebody doing what you were doing at that time might develop a thought that somebody knows, somebody's watching, somebody is surveilling me while I do this?
I think it's to be more careful of not getting caught.
Not getting caught.
Right.
Any other reason that a person might have those thoughts of somebody knows? Gotta be careful. The cops know somehow.
If it was delusional, maybe.
What do you mean by delusion?
Not based on reality.
Okay. Anything else that defines delusional for you as you were thinking then?
No.
One of the things that comes to my mind is that people who are doing something and feeling guilty about it at some level, conscious, unconscious, often have the thought that someone else knows or think a lot about somebody knowing or figuring it out or knowing what I'm doing because what I'm doing is wrong. Does that ring a bell at all with the way you thought back then?
No, rightness and wrongness did come into play. Okay.
How about now, looking back, do you think that the thought that the cops know and there are more police cars than usual, you think that might have had to do with some feeling that you were doing something wrong, looking back on it?
Could be.
Is there anything else in them? Could be.
No.
Okay. Body dysmorphic disorder. Tell me about body dysmorphic disorder.
Oh, I wasn't happy that I had poor vision and bad sinuses. Unhappy with my hair, that kind of thing.
You had bad sinuses. Were you taking medication for your sinuses?
No.
So you were unhappy with those things. How much did you worry about them or focus on them at the time?
Not that much.
Check yourself in the mirror, how you looked.
Yeah. I'd say most people do that anyway.
You were concerned about how often you checked yourself in the mirror.
Yeah, I did a lot.
And you thought in the notebook anyway that was too much for some reason. Do you recall that?
Yeah.
And you've got a whole list of personality disorders. Borderline, narcissistic, anxious, avoidant, obsessive compulsive, and chronic insomnia. Were you having trouble sleeping?
Yeah.
I do recall you mentioning that. Tell me about the insomnia and getting to sleep during those.
I would just toss and turn before trying to get to sleep. And I couldn't get to sleep right away.
Do you remember thoughts that you would have as you would try to sleep, try to get to sleep? It was a long time ago.
No, I don't.
Do you still have trouble getting to sleep, trying to get to sleep?
Well, I sleep so much now that I usually stay awake, kind of restless at night.
You have the word psychosis. What does psychosis translate to 25 months ago?
I don't remember.
Really?
Yeah.
What does it translate to today for you? What do you mean by psychosis? Or when I say psychosis, what does that mean to you?
I don't have a definition of it.
A rough definition.
Psychotic in some way.
What does psychotic mean?
Abnormal.
Anything else besides just abnormal?
Delusional.
And you already said delusions had to do with believing things that weren't true. Is that pretty much what you said?
Believing things that didn't have a basis in reality.
Okay. Trichotillomania.
Hair pulling. I had that. I still have that.
When did you first start, that you recall, pulling out your hair, what you think is more than average?
Early high school.
much hair pulling did you do?
I don't know how to quantify it, just enough not to be noticed, but not too much.
At what point does that turn into trichotillomania, so far as you know? How much hair pulling do you have to do to be...
Like every day, basically.
Okay. Adjustment disorder, pain disorder. Pain. What sort of pain, may I ask?
I don't remember.
Physical pain, emotional pain?
I don't remember even that much.
Okay. Restless leg syndrome.
Yeah, I have that.
What was that like?
That was part of the trouble getting to sleep. My legs were kind of...
Can you describe that?
My legs would kind of twitch without me moving any muscle.
Looking back on it, do you think those were realistic potential diagnoses? Or do you think it was overkill or underkill? I don't know what that sound was.
Medical emergency, Edward 2. Medical emergency, Edward 2.
So looking back, what was the realistic applicability of that list of diagnoses to you in May, June, July of 2012?
They were just thoughts I had. And from the research I did online.
And looking back now, was any of them particularly accurate?
I don't know. I thought they were accurate at the time.
At the time? Okay. And looking back though, now, what do you think?
Yeah, I don't think I had autism or some of the other ones.
Any ones that you think you did have?
Schizophrenia, obsessive compulsive disorder, social anxiety.
Okay. What are the characteristics that you look back on now that make you believe or think there's a strong possibility that you had schizophrenia then?
I don't know how to answer that.
And maybe it was a confusing question. Looking back with what you know now, and you said that there was a fair potential that you had schizophrenia. What symptoms or signs do you see now in yourself at that time? I don't mean in yourself now, I mean in yourself at that time.
Just kind of delusions of grandeur, a bit of paranoia.
You mentioned the paranoia before. And how about the delusions of grandeur? What do you mean by that? Can you explain that to me in terms of the way you were?
That I could be worth more by doing it.
Okay. Do you still have that thought? You said yesterday. Do you still have that thought?
Yeah.
Okay. Is it stronger or less strong or about the same now?
It's pretty much the same.
As you recall it being back then?
Yeah.
Any other things that make you think that you had schizophrenia at the time?
I was seeing weird shadows.
Tell me about that.
Well, I'd be in lab and there'd be like a flickering in my peripheral vision, and then there'd be like shadows moving with nothing causing them.
People see things in their peripheral vision from time to time. It may or may not be abnormal. So can you describe to me a little bit more about it and why you believed it was abnormal at the time?
Just that nothing I saw that could have caused those shadows to move made them move. And that was in my frontal vision after I turned to see what the flickering was, kind of thing. So I could actually see shadows in front of me that were kind of dancing.
Straight on rather than in the peripheral once you turned your head.
Right.
Tell me more about that. What did that look like?
Usually it looked like just the shape of a person, and maybe they were like jungling or doing something.
I'm sorry, like
Juggling. Yeah.
Any thought about what that might have meant?
No.
Or what the figure might have been or represented?
I don't think there was any rhyme or reason to it.
At the time, did you try to interpret the vision or figure out what it was? Vision wasn't your term, that was my term, I guess. Did you try to interpret the shadow or the shape?
I tried to make sense of it, but there was nothing.
What came to mind as you tried to make sense? In what way did you try to make sense of it?
I was trying to figure out why it was there.
What possibilities did you come up with?
That I was seeing things, or that something was making it.
So one possibility is you were seeing things, and one possibility is that
it really was.
It was there for some reason. What things might have put it there? In what? How might it have been real? I guess I'm asking. What are those possibilities?
I don't understand.
If you weren't seeing things,
right?
What was it? What was creating it?
See, I didn't notice anything that was creating it.
Did you have any thoughts about what might have been creating it?
No.
Okay. Do you remember the first time you ever saw shadows like that?
That was the first time.
Working in labs while you were in grad school?
Yeah.
Okay. You remember roughly whether it was close to or what month it was, or what class it was?
It was my third rotation.
So it would have been in...
So before I started buying weapons and then overlapping it.
Okay. Thank you for kind of locating that. Earlier in college, when you were living at home, in high school, things like that ever happened to you?
No.
Once it started happening, did it get more frequent or less frequent?
No, it was relatively infrequent.
Relatively infrequent. Did the experiences become more vivid or less vivid when they happened, or stay the same?
They stayed the same.
Okay. When you say infrequent, roughly how many times did it happen?
Before I was in jail?
Mm-hmm. Yes.
Maybe once a week.
Okay. How about after you were in jail?
Maybe 2 or 3 times a week.
In a similar fashion or in a different fashion?
Similar fashion.
When you saw these things before you were in jail, what was your reaction to them?
I don't know. I thought they were unusual.
Were you frightened of them, or delighted to see them, or curious about them, or what?
No, kind of apathetic towards them.
But it sounds like you tried to figure them out, or not.
I tried to figure out what was causing them.
And once again, what did you come up with as the best possibility or possibilities from what was causing it?
Nothing was causing them, so I just kind of went with the flow.
Thoughts that they were beings from another dimension, or
No,
ghosts, or figments of your imagination, or reflections? Lots of things come to my mind, but I'm interested in what might have come to your mind.
I thought they were shadows.
Shadows.
Yeah.
You used the word apathetic. Did you attribute, have you seen them lately? Have you continued to see them?
Sometimes.
In the past month, have you seen them?
Yeah.
In a similar fashion to 2 years ago?
Yeah.
Do you recall what you were doing the last time you saw them?
Staring at a wall or ceiling. You kind of form on flat surfaces.
Did they tend to form on flat surfaces earlier as well?
No, then it was on any surface.
Okay. Is it distressing to you to see them?
No. It doesn't bother me.
Are they particularly interested in you, or are they just there and you happen to see them while they're there?
I don't know how a shadow could be interested in me, so I guess they're just there and doing their own thing.
Are they doing anything malevolent or dangerous to you?
Not to me, no.
How about to anyone else, as far as you can tell, as far as you feel?
Just to other shadows.
To other shadows? Tell me how that works, can you? Or what the thought is about that they may be dangerous to other shadows?
Well, there's like shadows with axes and swords and like guns. And they can be destroying other shadows.
And do you see the shadows with swords and guns and axes? As you see them?
With shadow swords, with shadow swords and axes.
Okay.
So
You seem to be describing a two-dimensional phenomenon rather than a three-dimensional phenomenon.
right, it's two-dimensional.
So the shadows that you would see, you can make out, I'll call it a silhouette of an axe or a sword or a gun. Is that accurate?
Yeah, it sounds.
You mentioned it real early when you saw him. One of the impressions was that it looked a little like somebody who was juggling.
Right.
How did that become shadows with weapons?
Well, it was juggling heads.
It was juggling it.
Yeah.
Did you perceive that when you first saw it back in early 2012? That it was juggling heads?
Yeah, it was the same.
That seems frightening to me. It wasn't frightening to you.
Well, they're all shadows, so they can't do anything to you.
What might be throwing the shadow? You know what I mean?
That's what I kind of wanted to figure out, but there was nothing making the shadow. It was just kind of like, kind of static points.
How long would they stick around once you saw them in your, correct me if I'm wrong, saw them in the peripheral vision, turned your head and saw them full on? And it sounds like sometimes they appeared full on.
As long as I focused on them, and then if I stopped focusing on them, then it just became a wall again.
So that would be roughly how long in minutes?
Like 3 to 5 minutes.
Do you recall in 2012, before you were arrested, where you usually were when the shadows appeared?
In my bedroom, like like looking at the ceiling.
Was it then when you were likely to be in bed or not necessarily?
When I was in bed, usually.
Okay. That suggests to me that you were going to sleep or trying to go to sleep or waking up or perhaps even asleep and dreaming at that time. Does that make sense or is that not accurate?
When I was restless, trying to get to sleep.
Okay. Were the lights on or off?
They were off.
After you were arrested and up to the present time, you described seeing them on a wall rather than the ceiling. Were you not in bed or not trying to sleep?
In jail, what are you talking about?
Yeah.
I could see them on either wall or ceiling.
So you could be sitting up, perfectly alert, and a shadow might appear.
Yeah.
Can they appear when you bid them to appear?
Yeah.
Do you sometimes bid them to appear?
If I'm particularly bored, yeah.
I'm going to wait for that refrigerator sound to go away so I can hear you a little better. At least I think it will, clearly. So you can cause them to appear.
I can cause them to.
You can, and sometimes when you're bored, you will.
Right.
So, do they appear also unbidden nowadays?
Sometimes.
Speaking currently, the last few months, how often do they appear unbidden compared to appearing because you wish for them to appear because you're bored?
2 or 3 times a week.
What's the ratio of one to the other? Roughly.
Mainly I make them appear more than they come unbidden.
Now let's go back, if you will, to 2012, early 2012, mid-2012. Were you able to cause them to appear then? Or no?
No. Causing them to appear has only been since I've been in jail.
Okay. Once again, speaking today, I guess, where do you think they come from?
My own mind.
Sounds like a creative part of your mind. Sounds useful, actually. When you're bored, you bring them in. Does that make sense? It
Yeah.
sounds useful sometimes. As you bring them into being, do they always have weapons and axes and guns and swords? Or sometimes do they have other things?
Sometimes it's just their body, and it's like breaking apart.
Breaking apart?
Yeah, like hands flying off or something.
Are there ever other things that they do or carry?
They spin around.
I'm sorry,
They spin around
spin
sometimes.
around. Excuse me. Do they ever do more entertaining things than...
No.
The things you've described them as doing or characteristics have all been having to do with violence in general, I guess, hands falling off, swords, guns. Do they ever appear more benign, if you will?
Not really, no.
Okay. Anything else about them that I should know or that you want to tell me about?
No.
Okay, thank you.
care about that.
Okay. It's another part of the body, like hands flying off, or
No.
you mentioned a traumatic experience. Let me see what you said. When you were a youngster, I think. Is it in this paragraph? Was there something that happened to your genitalia when you were very young, or when you were young?
No.
How do you see your genitalia? Normal, abnormal?
Small, I guess.
Do you think your penis is really small, or just you perceive it to be small?
Well, based on national averages, it's small.
Okay. May I ask how small?
Not that small.
Is that something that concerned you in early 2012?
Not really, you know.
It was enough to write it down, among other things.
Right,
As
as
a bullet
part of
point.
the body dysmorphic disorder.
Okay. A slab of skin was torn away. How did that happen?
I don't remember.
Really? You don't remember about that? Most guys remember when they have an injury to the penis. What happened?
I don't want to talk about it.
Did it involve someone else who hurt you, or not?
No.
You mentioned on the same page that you have difficulty conveying the images that you see in your mind. And you and I have experienced that here.
Yeah.
Pictured something, and it's sometimes hard for you to describe the image or the video, as I sometimes call it. And you say it would be nice if there was some form of telepathy to transfer the image.
Right, to just speak through an image instead of having to use words.
Did you ever figure out how to do that?
I think the closest thing would be being able to draw, but I'm not a very good artist.
There are some drawings in the notebook. Do you draw other times, or are there other things that you draw?
No, I don't draw very much at all.
I don't recall being supplied with any drawings from you in the jail over the last couple of years. Is that accurate, or?
Oh, I drew like a couple of pictures, but that's about it.
Where are those pictures?
They're in my jail bucket.
Okay, in the book. You don't have them up on the wall?
No.
You do have some other pictures up on the wall. You've got two wall places in your
blue
cell.
squares to put
Two blue
pictures on.
squares.
Yeah.
And one of them has pictures of lots of pretty women.
Mainly because those are the pictures I received in the mail early on.
Have you put up any new ones lately, or are those all from early on?
All my mail's been confiscated by lawyers. So I haven't gotten mail from supporters in like a year and a half.
Okay. And you've kept the pictures up on the wall, or have you taken some of them down? Or?
I just leave them up there.
Okay. Any particular reason? Or just decoration, or what?
Something besides the monotony of a white wall.
Makes sense to me. Oh, makes sense to me. What was your feeling, or what were your thoughts when you got that supportive mail, a lot of it having pictures enclosed, in the first few weeks or months that you were in jail?
I thought it was very kind of people to send their support.
Some of that mail was religious in nature, wanting to, the support was a religious support in nature, wanting you to believe
certain Bible passages, that kind of thing.
And did you appreciate that as well, or
I still thought it was a nice thing to do.
a nice thing to do?
Yeah.
Some folks sent cash for your commissary fund.
Yep.
Is that a nice thing to do?
I would say so, yeah.
On the other square in your cell, there are fewer pictures, but a different kind of picture. Can you tell me about the other square?
They're mostly like landscape photos. So like photos of Boulder, Colorado. One of like Switzerland or something. One of like a tiger.
There are a couple of photographs that are either of family or friends. Do you recall what those photographs are?
I have one photograph of my family up there. Yeah.
Who all is in the photograph?
My mom, my sister, my dad, and me.
And you? Any photographs of friends from before you were arrested?
Nope.
We talked a bit yesterday about the evolution, if you will, of your thoughts of killing or your urges to kill or the images that would come to mind of killing people. You talked about early ones being abstract in the sense of the saws, as I recall, in the sense of the nuclear winter or the atomic bomb blast, right?
Right.
Here you talk about, in your notebook, the obsession to kill since I was a kid. Started pretty early, or is that not an accurate description?
Not the imaging.
I'm sorry, what?
Just having an obsession to kill was when I was a kid. I didn't necessarily have the images.
Tell me what you remember about that obsession to kill when you were a kid. We're talking about, I suppose, 10, or what age are we talking about?
Middle school.
Tell me about that obsession to kill and what it was like, what you were thinking at the time.
I don't remember what the obsession was exactly.
Any speculation about what it might have been like?
Just that I had a strong inner thoughts of killing people.
What were those people like? Were they doing something to you, or?
No, they were just abstract humankind.
Okay. Did you put any identification on any of them?
No.
Relatives, friends, enemies?
No.
Teachers?
No.
Bad guys on TV?
No.
Did you ever act out any of that in some way, drawing stuff or with your toys, playing cowboys and Indians? I'm not talking about actually killing people, but did that ever come out in any kind of, I'll call it symbolic behavior or something to get it out of you?
No.
No drawings of killings and things like that that you can recall?
No.
Did you like to draw when you were a kid?
No.
Okay. Anybody like Mel ever ask you to draw stuff? Counselors sometimes
No, I
ask.
don't think he did.
Okay. Counselors sometimes ask kids to draw things. That makes me think the concept of hating people or hating mankind. Was there a juxtaposition of that as well when you were in middle school?
Yeah, I didn't like mankind particularly.
Didn't like mankind as broccoli, as we were talking about, or didn't like them and wanted to kill them?
Wanting to kill them. So there wasn't any hate, but still wanted to kill them.
All right, I'm going to turn the lights back on. The record should reflect the people have stopped the publishing of P-TR-1007 for now. It is almost 5 o'clock, folks, so we're going to go ahead and adjourn for the day. Please remember that the advisements apply tonight, so make sure you follow each and every one of them. Get some rest tonight, and I'll see you tomorrow morning at the usual time, okay? Thank you. Please be seated, everyone. The record should reflect that the jury has exited the courtroom. I have a couple of issues to talk to counsel about. The first one has to do with the conversation that I had with juror number 901 outside the presence of the other jurors earlier today. Our public information officer, Rob McCollum, received an email from a Kathy Newstadt, KATHYNEUSTADT, at 4:10 this afternoon, and it reads as follows. I just got home and Carol McKinley filled me in on what happened in court after the break and about the juror who said someone talked to her at lunch. I was standing in line to get coffee and there was a woman fanning herself behind me, and I said, "Hot?" And she said, "Yes." I said, "I just came back from Florida," and talk about hot. I had no idea she was a juror, especially on this case. Today was my second day in the courtroom, and I did not recognize her, nor honestly would I recognize any of the jurors. I mostly work from the trailers in the media lot. I profusely apologize and will make certain I never ever talk to anyone who I don't already know while in the courthouse for fear of this happening again. I am happy to talk to the court if need be. I freelance for ABC, but was there on my own volition today and was not being paid. My number is, and then she provides her phone number, or a phone number, and then it says, I never, ever, ever would talk to someone I knew was a juror. I know the severity and the consequences. And then it has her name at the end of the email. So, just wanted to supplement the record with that. The other issue that I had that I wanted to talk to counsel about has to do with the proposed defense instruction, defense standard instruction number 1, which relates to the theater demonstrative exhibit, physical demonstrative exhibit. Ms. Pearson, are you ready to address that now?
Yes, Your Honor, I am. Your Honor, we don't object to the first paragraph, which is simply a factual description of what occurred with regard to the mark on it. We do object to the rest of it, and the defense counsel indicated they had taken this from the court's order D-216, somewhat loosely taken it from that, I would say. And I think the second paragraph is confusing. It doesn't make any sense. It attempts to, obviously from their perspective, to diminish the value of the exhibit. But the other point at this juncture, we have laid enough foundation with regard to the theater model to actually introduce it as an exhibit. We've had Brett Mills testify that the data used for his trajectories was used to make the model, that he was involved in watching that process occur and watching it be made, and that in fact it was made to scale. So at this point, we would move to admit it as an exhibit. But we have no objection, as I said, to the first paragraph that is contained on their instruction. If they want that, is just to make it clear to the jury what the marks were and that they were taken off.
All right, Ms. Spengler, do you have any position on the people's request to admit the physical model of the theater or part of the theater into evidence? And if you're not prepared to address that now, I will give you time to prepare. I know that you may not have been expecting that request.
Yes, Your Honor, if we could have just a bit of time.
Okay. All right, we'll hold off then, and then we'll address it later. We'll continue to table it. Mr. King?
I'm sorry, Judge. Is the court done? I had one issue I wanted to raise.
Those were my two.
And my issue is I hate to beat a dead horse here, but I just want to be absolutely clear. The last time we had a discussion about the progress in the prosecution's case and when our case was expected to begin, I told the court that we would be ready on July 1st. And the court indicated, and quite clearly, and I'm just checking in to make sure that I heard you correctly, that you were giving the prosecution 8 weeks and only 8 weeks, and that I needed to be able to be prepared to present my case at that point. As I count the weeks, Judge, that means that my case would begin on the 22nd of June. And I'm confirming with the court that that's the date that we're expected to begin, because we're actually at the point where we have to start scheduling things and airplane flights and all kinds of things. And we really need to know what day is the beginning day.
Well, I think the agreement we made, all three of us, you, Mr. Bruckler, and me, was that we would hold off for 2 weeks. And then in 2 weeks, the prosecution said they would be in a better position to tell whether they needed beyond that week of June 23rd. I think what I had said was that that you should plan on starting around June 29 or June 30, but that my preference would be that you would start the week of June 22nd. That's my recollection. And I'm waiting until the end of the week, because that's the end of the 2 weeks, and then we'll have the discussion. There have been some delays, in part because of technical difficulties and in part because a couple of jurors have not been feeling well. But I am eager to keep pushing this trial along, obviously, but we'll chat on Friday. So let's plan on having that discussion on Friday afternoon at some point, okay?
Okay, then we'll do the best we can until then.
Yes, thank you. All right, anything else, Mr. King?
No, Judge.
All right, Mr. Orman?
Your Honor, I have just one, and then Mr. Edson has a brief. We had a brief bench conference that was not on the record. I just wanted to make a brief record about what that was. It was a sort of a pseudo-migraine, an ocular migraine I was having, and I was going to have to close my eyes while I was seated at the counsel table. And I just wanted to inform the court of what I would be doing, and that it did not mean any disrespect for the court, and that I was not sleeping. And the court allowed me to inform the court of that, and that's what that bench conference was.
That is correct. All right, Mr. Edson?
Judge, briefly, during portions of the video testimony, I'm sure the court has noticed I've not been here. I've been taking care of some additional work, case-related, and taking advantage of that time. Tomorrow, Judge, with the court's permission, I may not be here until about 10 o'clock, again, working on case-specific stuff outside of the courtroom.
Okay, thank you. Is there anything else from anyone else? I'll be here right at 8:40. All right, I'll see you tomorrow morning. The court will be in recess. Thank you.
Please rise.